Hi, welcome to our presentation. So today we will be discussing possible methods to detect an early onset of cerebral venous sinus thrombosis, or CVST. So before we get started, a little about me. My name is Annyesha. I'm from South Riding, Virginia. I'm 18 years old, and I'm a senior at Freedom High School and the Academies of Loudoun, and I aspire to pursue a career in medicine. A little about my project. With the help of my amazing mentor, Catherine, I was able to get my feet wet with neuroscience research, particularly with cerebral venous sinus thrombosis. And why I chose to research a specific topic is because my mother did suffer from CVST shortly after my birth. And it just left many unanswered questions as to why her, and were there any markers or indicators that could have warned us about it. So let's get started. What is CVST? By definition, CVST is a rare but serious blood clot in the brain's venous sinuses, which prevents proper drainage of blood. As a result, increased intracranial pressure, which can lead to brain swelling, bleeding, and stroke. It's caused by hypercoagulable states such as pregnancy, postpartum, and clotting disorders, or infections, meningitis, medications, or chronic conditions, or autoimmune diseases. Symptoms include severe headaches, which is often the most common among patients and is quite persistent, and also includes vision problems, which includes blurred vision, blurry double vision, loss of vision, seizures, stroke-like symptoms such as weakness, difficulty speaking, confusion, or one side of the face drooping, nausea, vomiting, and an altered consciousness. Diagnosis includes the use of an MRI or MRV, which is the preferred imaging method as of now. CT scans with contrast are also used, but this may show the clot, but it is a little less sensitive. D-dimer blood tests is a new and uprising method, and it is still under study whether it is quite reliable or not, and it is going to be one of our topics of discussion today. And the prognosis varies. Some patients recover fully, but with long-term complications. But early detection improves the outcomes. And complications include chronic headaches, neurological deficits that may persist. Treatments include anticoagulants such as heparin, warfarin that prevent further clotting, thrombolysis, which are clot bursting drugs in severe cases, and management of symptoms such as seizure control, reducing the brain swelling, treating underlying causes such as stopping the hormone therapy, or managing the infections. Now, getting to our research question. How can hyperhomocysteemia and elevated D-dimer levels be established as a reliable detection method of cerebral venous sinus thrombosis, or CVST, in postpartum and pregnant women? So one of our main focuses, which is detection. So we're going to talk about hyperhomocysteemia and elevated D-dimer levels. So hyperhomocysteemia, what is it? So it is the state of elevated homocysteine, which is an amino acid, levels in the blood. Causes include genetic mutations of the cystathionine beta synthase gene, or the CBS gene, or a deficiency of it, and environmental factors such as diet and medication. There is a thrombotic risk caused by hyperhomocysteemia because it promotes clot formation by interacting with blood components. It is linked to CVST because it is caused by a CVS mutation and has been linked with several cases of CVST. Cases of hyperhomocysteemia that links to CVST include multiple reports and documents of CVST in patients with elevated homocysteine levels, often without major risk factors. Case studies highlight patients with recurrent thrombotic events, such as suggesting a chronic prothrombic state due to the hyperhomocysteemia. Some cases involve peripartum or postpartum women, which is going to be another one of our focuses, and is also pertains to my case, my mother's case, which reinforces the role of homocysteine or hyperhomocysteemia in pregnancy-related CVST. And now we're going to go on to the elevated D-dimer levels. So similar to homocysteine, D-dimers are also a marker for CVST. D-dimers have been used to diagnose CVST, and this detection method is still under study, as we did say before. And key findings from a study did say that in 2016, 139 CVST patients were analyzed, and it was found that 46.8% of the CVST patients had elevated D-dimer levels. And our next main focus, the population. Who are we talking about? Who are at the biggest risk? So people at the biggest risk, the population at the highest risk of CVST are pregnant or postpartum women. Because, and this is due to the hormonal and physiological changes caused by pregnancy that elevate the risk of CVST in pregnant and postpartum women. Hypercoagulability is a state that is pretty persistent and pretty common during pregnancy because pregnancy induces a prothrombotic state due to increased clotting factors such as fibrinogen or factor V2, V3, and von Willebrand factor, and decreased fibrinolysis that predisposes women to thrombosis, which is the clotting of blood. Venous stasis, or an enlarged uterus which compresses the major veins, leads to slowed blood flow, which is also a key feature in thrombogenesis. Endothelial injury, so delivery-related trauma. So this is for the postpartum women. During C-sections, and inflammation can damage vascular endothelium, which triggers clot formation. And the peripartum risk window, which is when there's the highest CVST risk, which is during the first 6 weeks post-delivery or postpartum, when coagulation factors peak and anticoagulant proteins remain suppressed. Genetic and nutritional factors, folate and vitamin B deficiencies, along with genetic predispositions such as the CBS mutations that cause that CBS deficiency, they exacerbate hyperhomocysteemia and the susceptibility for CVST. And also, something we're going to talk about later on are spinal anesthesia, hypotension, and CSF leak. So, homocysteine, what is it? So homocysteine, by definition, is a sulfur-containing amino acid that is produced during methionine metabolism. Its metabolic pathways include remethylation, which converts homocysteine back to methionine with the help of vitamin B12 and folate, and transsulfuration, which converts homocysteine into cysteine via cystathionine beta synthase, or the CBS enzyme. Now, it is regulated and maintained at low levels when vitamin B6, B12, and folate metabolism happens properly and correctly. And its pathological effects are that elevated homocysteine or hyperhomocysteemia leads to endothelial dysfunction, oxidative stress, prothrombotic state, increasing the risk of CVST. And this visual right here, I have created this. It is the method of homocysteine. I created this through BioRender. So, hyperhomocysteemia, what is it? As we discussed, it is the elevated homocysteine levels due to the CBS mutations, CBS gene mutations, and more importantly, the vitamin deficiencies of B6, B12, and folate, and many other metabolic dysfunctions because homocysteine does follow a metabolic pathway. It is caused by impaired methionine metabolism. Normally, homocysteine is metabolized through remethylation, which turns it into methionine, or transsulfuration, which turns it into cysteine. Deficiencies in the CBS or MTHFR genes disrupt these pathways and leads to an accumulation or buildup of homocysteine in the blood. Prothrombotic effects excess homocysteine damages the endothelial lining of blood vessels. It increases oxidative stress, impairs anticoagulants. Mechanisms fostering a hypercoagulable state are created through this, and direct link to CVST because elevated homocysteine levels promote venous endothelial injury, which leads to platelet aggregation and clot, which directly contributes to the CVST development. Clinical evidence, which is quite important, shows that studies have found a higher prevalence of hypercysteemia in CVST patients with, and very importantly, with CBS mutations and vitamin deficiencies of the B6, B12, and folate, which is frequently detected among affected individuals. Now, another one of our main points, which is spinal anesthesia and its relation to CVST. So with spinal anesthesia, there is an increased risk of intracranial hypertension. Spinal anesthesia can lead to a cerebral spinal fluid or CSF leakage, causing intracranial hypertension, which reduces venous outflow and predisposes of cerebral venous veins to thrombosis, causing CVST. And the venous stasis and hypercoagulability. So post or after the administration of spinal anesthesia, patients experience restricted mobility and dehydration, both of which contribute to venous stasis, which is a key factor in CVST pathogenesis. Altered coagulation dynamics, physiological stress induced by spinal anesthesia may trigger a prothrombotic response, exacerbating underlying risk factors such as hyperhomocystinemia or hormonal changes in postpartum women. Case evidence includes clinical reports that have documented CVST occurring in postpartum women following spinal anesthesia, suggesting a possible correlation between CSF leakage, venous stasis, and thrombosis formation in susceptible individuals, meaning postpartum and pregnant women. So, in conclusion, what is the point of all of this? So, the point of this research and this work is to encourage that pregnant women should undergo testing for hyperhomocystinemia and elevated D-dimer levels before adding or incorporating spinal anesthesia, otherwise known as epidural, into their birth plan. Reasoning being that hyperhomocystinemia and elevated D-dimer levels, as we previously discussed, have been strongly associated with the prevalence of CVST. Prothrombic conditions during pregnancy makes it crucial that pregnant women are able to take necessary precautions to avoid complications. This helps reduce complications during or after birth. Spinal anesthesia has also been found to supplement hypercoagulability during pregnancy. So that is it. Thank you so much. Are planning to be pregnant and are building a safe and workable birth plan. Thank you.